Good morning, everyone. Thank you so much. Thank you so much. I accept your warm welcome on behalf of my House Democratic Caucus, of whom I'm very proud. Tell them, here they are, that over 60% women, people of color, and LGBT community members, over 60%. I always say our diversity is our strength, but our unity is our power. And that's what we have to exert right now at this difficult time in our country. I come here on behalf of that caucus and the Congress to thank you all for what you are doing to improve the health care of all Americans. I want to thank Frederick for his leadership and wish him well as he goes forward. He stands in some mighty footsteps of Ron Pollock, who worked so hard for so many years for Families USA. And of course, our inspiration, support, and just leader, Phil Villers, and he and Kate, thank you so much. Thank you so much. Chairman of the board, the president of Families USA. We were just talking about God's work. People always like to say, I hope God blesses our work. And there are others who say, why don't we just do God's work? He has already blessed that. That's what Phil Villers is doing in Families USA. Thank you so much. Thank you so much. Well, thank all of you. Here we are on a Democratic majority in the House of Representatives. I don't say that politically. I say that from a values-based perspective. And how did that happen? Well, you should all have satisfaction that you were so much an important part of that. Not necessarily in a political way, but the most important issue in the campaign was the issue of health care, whether it was the cost of prescription drugs, whether it was the pre-existing condition benefit of being protected, with the cost of health care in general or access to it. That was the most important issue in the campaign. And people say, how did that emerge as the most important issue, where there's so much financial insecurity, and that's certainly an issue, and other concerns about, shall we say, the strength of our democracy for one reason or another. But that happened because of all of you. The fight that was made in the past 2 years to stave off the repeal of the Affordable Care Act, the grassroots effort that went into that made people aware of what was at risk and what could be better. I say to my colleagues, and I say to the press, and I say to the president, 10,000 events across the country, 10,000 grassroots events to protect the Affordable Care Act, to stave off the assaults on it. That would not have happened without so many of you in Families USA and your associate organizations. It was about individuals taking responsibility, joining an organization, creating coalitions, working together to increase the voice of the people in matters that have direct impact on their lives. You transmitted that to others. Imagine 10,000 events. They did some damage in their tax bill, which we couldn't stop. As I say, in the dark of night, the speed of light, no hearings, no nothing. They pass a bill that gives 83% of the benefits to the top 1%, at the same time eliminating the individual mandate, which was the basis of their court case, which we are obviously fighting. I'm very proud of my members united around that, and Colin Allred had the legislation on the floor to have Congress, the House, go forward in that case. But really, take pride in what you have done. But there's more work to be done. Congratulations to the 3 states that won in the fight to expand Medicaid. Imagine that. How exciting that is. How exciting that is. But they are making other assaults on Medicaid, and it's really very sad because in so much of what they do, they not only hurt our families, our children, and the rest, they also hurt our veterans. Well over 1 million veterans are on Medicaid as well. Well over a third of the federal workforce are veterans, and they're being hurt by this shutdown. So when they want to pronounce their support for veterans and families, and they make an assault on Medicaid, they're making an assault on those very fundamental units of our society, which we hold dear. But you don't. You don't make that assault. You make the opposite. You lift it up, and for that we are very grateful. So here we are. I always like to place this in time, well over a month into a shutdown. Tomorrow will be a day when the second paycheck will not arrive. And why? There is no real why. We can open up government and debate the issue of how we protect our borders. We all want to secure our borders. But as we protect our borders, we must protect our values as well as a nation. And you'll hear from Sister Simone. We all believe, many of us who are involved in this public policy debate, believe that we are all God's children, that we all contain a spark of divinity within us that is worthy of respect. As we treat other people, we also remember we have that spark of divinity ourselves, and it carries with it responsibilities to respect the dignity and worth of every person, to respect the dignity and worth. And that means in every way. We're at a time when the disparity in income in our country is immoral. It used to be maybe 40-some years ago that the CEO earned 40 times what the workers did. And when productivity went up, the income went up of the CEO and of the workers. That changed over time because it was all about the bottom line and quarterly reports. And now the disparity between the CEO and the worker is more like 350 or 400 times. Many CEOs have already made what their workers will make working all year. Some of them did it in the first few days of this year, certainly within the first week. That is an immorality, it is indecent, it is sinful, and it's something that we must work to change. But again, in our For the People agenda, which was our election and is our promise, and that is our agenda as we go forward, for the people, to lower the cost of health care by starting with lowering the cost of prescription drugs and preserving the benefits contained in the Affordable Care Act, to expand Medicaid, as we have decided, to consider all options to have us reach health care for all Americans, to increase lower cost of health care, increase paychecks by building the infrastructure of America, to do so in a green way that honors our stewardship of this planet as God's creation. Again, from a moral standpoint, it is God's creation. We have a moral responsibility to be good stewards of it. But even if you don't share that view, we all have a moral responsibility to future generations to be good caretakers of the planet and pass it on responsibly. But it's a health issue, too. It's a public health issue to protect our planet, and it's a national security issue, and it's it's an economic issue as well. So all of these things are connected. And one thing that connects them all is our third point in our For the People, is to reduce the cost of dark, special interest money in politics. We thank the Citizens United and other grassroots efforts to advance H.R. 1, it has the first name, and will be one of the earliest bills that we pass in the House, and hopefully with public opinion in the Senate and sent to the President's desk. But it empowers small donors, it stops voter suppression, it has within it passing the Voting Rights Act to correct what the United States Supreme Court did. But the connection between the issues of access to health care and cost and bigger paychecks and safety in the workplace and the rest, the connection to H.R. 1 is very direct. The cynicism that the public has that we cannot get the job done as long as big money has a bigger voice than people have in our government is something that we must reduce. We must increase their trust, reduce their cynicism, and reducing the role of big, dark, special interest money is a pledge that we have made, and it is something that we will work on and has a direct relationship to a positive, progressive agenda for our country. So thank you for seeing that connection between lowering healthcare costs and lowering the impact of big money in politics. In addition to that, we have other assaults that they are making on health care that are well known to you, and we will work requirements for Medicaid, et cetera, there are work requirements there, but they want to make them so unreasonable that, I mean, if you see them on the floor of the House, they say things like, when you work, you eat. You say, yeah, what? What about little children? God said, it's always, God said, when you work, you eat. And I'm saying, well, what about little children? What about adults without children but who have other needs? What is that? What is that? I don't know what that is. I don't get it, but apparently there's a market for it. They don't seem to say is you have to work to get a gigantic farm subsidy when you're nowhere near a farm for get hundreds of thousands of dollars. So in any event, just to let you know what our agenda is, there's several other things in addition to reducing the cost of health care, improving the pay, increasing the paycheck, and increasing the respect that people will have for government. We also said we would do three things as soon as possible, and one is to pass common sense background check legislation to reduce the gun violence epidemic in our country. Another is to pass the Equality Act, which ends discrimination against people, LGBTQ community in our country. And another is to protect our dreamers, and with them, our TPS recipients. So we think we are doing the Lord's work, and we continue to pray to God to bless it, but God truly blessed America with the activism of all of you. You've made such a tremendous difference. And when Frederick had the charts up there of participation in policy, more grassroots participation, they're all connected, because we not only want the grassroots to mobilize, we want them to give us their view of what public policy should be and how we message that public policy. That was our success in the last 2 years, because we would say, this is what we need to do. How does this translate to the people who are out there? And they saw everything, the grassroots that we were working with, and including many of you, through the prism of health care. If you want to talk about the tax bill, talk about health care. If you want to talk about the budget, talk about the tax bill and how it increases the national debt. And then the Republicans say it doesn't really increase the national debt, but if it does, we'll take, and that's $1.5 trillion, we'll take $1 trillion out of Medicaid, $1.5 trillion out of Medicare. So again, the point being, the effective messaging was what works at the grassroots level, which encourages people to take advocacy action, to make the calls, to show up at the town halls, to do the sit-ins, all the activism that you know so very, very well. So I'm here to say thank you to all of you. I hope, again, that you take satisfaction in what you do. I know you're going to hear from Sister Simone. If you think that I have been repetitive in some of what I said, Sister Simone always says to us, you have to say things 3 times. 3 times. So my favorite 3-time phrase right now is majority, majority, majority. Thank you all very much. Thank you.